This is your skills video for medication administration in a long-term care setting. So in a long-term care setting, you will have a setup similar to what I'm going to show you here, which is your own medication cart. Your medication cart will include individualized medications inside your cart. On the top, you will have usually some medication cups. You'll have paper cups or you will have measured cups. Oftentimes you'll have little cups here that you can put your water jug or your water cups in. You might have a splitter for your pills, and we will be using this today as I show you how to cut a pill, some alcohol wipes, things like that. You might have some other things in your cart. I will use this as a demonstration to do an injection in a belly for one of the medications that we're going to use. One thing that I just remembered that I forgot was my hand sanitizer. So, okay, as we look at my screen, and I'm going to pretend that my screen is up, this is my computer that is on my medication cart. I'm looking and I'm referencing here. I'm going to go be helping in the room. I'm right outside of the room, and I know that I'm helping Joseph Cool, age, long time ago. Male, date of birth, long time ago, medication number, blah, 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 blah. Here's his physician. Some of this stuff I do not need. I want to look at allergies here, and I also want to confirm with Joe on his allergies when I get in. Now I'm looking at medications. What time is it? I'm looking at the clock, right? My watch maybe I'm looking up above. I realize, let's say the time is 0800, okay? So I'm going to give everything at 0800. I see glyburide, 0800. How much? 2.5 milligrams. PO, that means by mouth, every AM. Furosemide, also known as Lasix, 40 milligrams. PO, again by mouth, daily. So we're going to give it now at 0800 because that's the time that they've put it to. Tylenol, looks like it's in liquid form, so I'll be looking for that when I get down to the cart. PO by mouth, daily, and they've scheduled it at 0800. I have heparin sodium, 5,000 units. 0800, looks like I need to put it in a certain site, so I'm going to have to make sure that I'm rotating sites on heparin. Heparin is an anticoagulant, so you're going to want to make sure you're looking for some bleeding risks, watching for bruising, and definitely rotating your sites around that belly. That's where we should be giving heparin, okay? That's just something I'm thinking about before I even get out these meds. If you have any questions on any of those, please utilize your drug book. You should have one on each med cart. Okay, looks like that is subcutaneous, so that is always in the fatty tissue. BID, the B stands for bi, which is two, so twice daily. So it looks like it's given at 0800 and 1600, which we know is in 4 p.m. military time. Okay? All right, so I'm going to go down to my cart and I'm going to take a look. All right, and I do see meds here. I'm going to take a look. I see two different forms of heparin. I'm just going to pull them out right now. I see a stock form of Tylenol. Usually Tylenol is not given to each individual resident. It's given in stock form. So you won't see a person's name on it. And then I'm going to grab the rest of the medications here, and it looks like Joseph Cool. I see furosemide, glyburide. I'm just going to set them all out here because they were in that person's cubby. All right, now I'm going to take a better look than I did, and just confirm, do I have the right medications out? So this is going to be my first check, okay? Glyburide, 5 milligram tabs, 2.5 milligram tabs. Okay, so I know I'm going to need this little guy, this pill cutter, okay? So I'm going to get him out, just set him to the side. All right, what else do I know? I know I've got Joseph Cool, date of birth long time ago, MRN, yes, it matches. Same everything, same what do I need to know? Right drug, right dose, right, so I've got right patient, right drug, right dose, right route, right time, right reason, right documentation, and that should be your 7 rights. Okay? And so every time you're looking at it, you're going to be saying that. I've got, here he is, here's the med, here's the dose I'm going to give. I know I need to cut it. This is all I can do for now. I also like to make sure I'm looking at the expiration date on the side. Okay, that's very important. So now I'm going to set this to the side. That's my one check, okay? I like to flip them over so I know I'm done checking that one. I like to go in order too. Furosemide. Well, here we go. I see furosemide here. Furosemide. I see Joseph Cool. So right patient, right drug, furosemide, right dose, 40 milligrams. So I'm not going to cut any of these pills. I know one of these is going to be the right dosage. Right route. It says tablet form, PO. I know I'm going to give this by mouth. This is going to be a daily dose, so it's at 0800. Sometimes it will say that on the card that you're going to give this daily. Right reason. If you're not sure what furosemide is a loop diuretic, so it's going to pull fluid off of the kidney, or pull fluid from the kidneys off of the heart. Okay? If you're not sure, please use your drug book again and understand a little bit of the function of each of these meds before you give them. All right, so we have everything here on furosemide's card. So I'm going to set it down, and I have done my first check on furosemide. I am moving on to Tylenol. Now, so this is your liquid acetaminophen. Now I'm not going to see Joseph Cool's name on it, but I am going to look at it, and I know it's a liquid form acetaminophen. Yes, it's a stock med. I see 325 milligrams per 5 milliliters written on this bottle. Now, as I look up here, it says Tylenol liquid. The dosage is 650 milligrams, PO daily. Well, I see that 325 milligrams is available every 5 mils. So I know I'm going to have to give twice as much to equal 650 milligrams. So I have to figure this out once I get to this amount. I'm going to have to figure this out. But I do have enough in here, and I know I've got the right bottle for this. So I'm going to set it aside. That's my first check on my Tylenol. Now I'm taking a look at both these heparins, okay? And I'm going to show you up close here. I have heparin sodium. One of them is 10,000 units per mil. The other one is 1,000 unit per mil. Now I look at my order and I see heparin sodium 5,000 units. So I know I need to give 5,000 units. Now generally I could give either one of these, right? I could give, well, let's see here, 10,000 units per mil. So I could give half of a mil and give 5,000 units of this, or I could give, for 1,000 units per mil, I could give up to 5 mils. But let me double check. Usually I don't want to give a very high level of quantity if I don't have to, okay? I have a 3 mil syringe, so I'm looking at this thinking this would be more ideal for me to do a half of a mil of the 10,000 units than it would be for me to give 5 milliliters of the 1,000 units per mil heparin. That's a lot more milliliters than I would need to put in somebody's belly. So I'm going to get my needle out, and I'm just going to set it to the side, and I am going to decide on my own here that I'm going to use the 10,000 per mil, and I'm probably going to end up using 0.5 mils to equal 5,000 units on this. So I'm going to set this here, and I'm going to put this one back just so I don't get myself confused. All right, that's my first check of meds. Second check, I'm going to go back now, okay? Second check usually involves putting your medication in the cup or drawing up that med. So this is going to be the part where I'm going to start putting things together now, okay? All right, so we've got first medication, Joseph Cool. We've got right patient, right drug, right dose, right route. Nothing's changed. Right time, I see it here. Right reason, glyburide. This is usually given for a diabetic patient. Like I said, don't give meds until you understand what the med is used for. This would be an oral diabetic medication. This is 2.5. I am going to punch out this pill. I'm going to use a paper cup. And because it's my first medication, I'm going to pop the whole pill into this container here. I am going to hold my cup securely in my hand on a flat surface here, and I am going to punch it into this cup. I like to have a firm grasp on this because it's much easier to have a good hold and your cup won't go flying. So there it is on the table, and I know I already talked about this. This is 5 milligrams and I need 2.5. So I want to take this pill out, but I'm not going to touch it with my bare hands because this is going to go in somebody's mouth, right? So I'm going to put a glove on. I am going to hold this pill. I am going to open the pill cutter. Oh, and I'm going to set it here on the scored side, so you can see there's a line on it. That's called the scored side. I'm going to line it up as best as I can with this glove on. And I'm going to splice it here. And I see I have half the pill. Now, when this happens, sometimes we aren't able to put that other pill back into the card. Sometimes we will then just discard this. So I am discarding this, and then I will sometimes then clean this out because you don't want to have somebody else's medication on this, okay? So there's that. I put that away. I've got that ready to go. I'm disposing of my gloves, and I am going to do a little hand hygiene, never leaving my sight of my medication that's in here. Second check is done. All right, moving on to the next one, right? Let's go to our furosemide, 40 milligrams. I see my right patient, right drug, right dose, right route, same, PO, right time, right reason, again. This is usually for a patient with congestive heart failure, somebody who has a lot of fluid on their heart. They need to keep releasing water through excreting it through their kidneys. 40 milligrams here. I feel confident in grabbing my cup and pushing this into the cup. I see it in the cup. It looks good to me. And then I'm going to set my pill container back down. What do I have next? Well, now I've got a liquid med, right? I have that Tylenol. I'm going to grab it. I'm going to look. Right patient. There's my patient. Not on the container, right? Because this is my stock med. But I see do I have the right med? Yes, I do. I have the right drug, acetaminophen, 325 milligrams. Well, I know I need twice the amount of that, right? My dosage is 650. So if I have to double that dosage, don't I have to double my milliliters? And yes, I do. So if I need 10 milliliters, I need to take my plastic measuring cup. I'm going to set it on a flat surface. You could always set it on your flat surface, but maybe I'd take a look first to see if I can find the 10. I see 10 mils here. You always want to make sure you can see that. Okay, so I'm going to set that down on a flat surface, and I'm going to take my eyes down to the level of that cup, and I am going to pour this until I see it at 10 milliliters. And I see it at 10, putting the cover back on. And I am going to set that aside. All right, so we're 3 meds through, and now we've got our last one here, which is our heparin, okay? We decided on the 10,000 units per mil, so I'm going to look at it again. Do I have the right patient? And the patient's name should be on here. Right drug, right dose, right route. Well, it says sub-Q. These vials should be, it will say an instruction on them as well. When you do a vial, you should always be scrubbing your hub for 15 seconds. You will learn that many, many times in the skills lab. So I'm going to just go ahead and start doing that. You can sometimes do this while you're scrubbing your hub. You can keep looking at that, reading your information, just making sure, okay, what did I say again? Okay, the order is 5,000 units. This is 10,000 units per mil. Am I going to use half of a mil then? Or am I going to use 2 mils? Maybe you get confused with your numbers, right? If you have 10,000 units for 1 mil, you need to cut that number in half. So your amount is going to be 0.5 mils. Now, if that confuses you, I want you to take a look at your container, at your syringe, and find 0.5, or in this case, are they measured in halves? What does that look like? I'm going to open up my syringe. I'm just going to take a look at it. All right, I see it measures all the way to 3. We're never going to need all the way to 3, but we are going to have to measure it to a half. It's not measured in 0.5. you see those two double lines on there? You're going to want the one that's furthest up. So where it's measured to is where we are going to fill the line to. I'm going to push it back down, and this is still sterile on the top. So I have not removed anything from my chamber yet. This sterile piece is going to connect to this sterile piece, and it twists on. So this is all staying sterile. I can get rid of my container there. And now I am going to just push this back. That's to lock it and close the cap on it. I'm going to open my needle up because now my container is all good. I checked my expiration date on here too and my lot number. Everything looks good. And now I'm going to go back to that half. We are at that half mark, okay? And I am going to place this. This is on a flat surface. I'm pushing it down into that soft part. I push the air in. I'm now going to invert this. I am showing you. I am drawing back. And it is definitely okay to draw back more if you want. And we want to get rid of those air bubbles as much as we can. So sometimes when I'm using water, it's a little harder to do this. I don't like to show you the air bubbles if I can avoid them, but there we go. Just gonna try to get them out of the way for you so you don't see that. But we are at, inevitably you are going to get air bubbles with water, okay? But this will, when it's a normal solution, you should be able to flick out most of the air bubbles. But we are at a half here. Before I release my syringe or my needle from the container, I am going to just set it back down. And when I have to cap this, I'm not technically recapping it. I'm doing what they call a sweep, okay? I set my cap down. I haven't stuffed anything inside of it. I am making sure that I can cover my needle safely before I go into Joseph's room and give this injection to him. Maybe I even want to label it before going into the room. All right, so all of these meds are here and they're ready to go. They're prepped. That is your check number 2. Now comes your last check. So this is your third check for your medication pass. So I'm going to flip the cards back over, take one last look. I've got everything prepared here now from our second check, and the third check is just going to be a review of what we just did. Okay, so do I have right patient, right drug, right dose, right route, right time, right reason, and obviously I'll document after we've given these meds. I see the glyburide, it was 5 milligrams, but we ended up cutting that pill. It's now a 2.5, which is what the medication MAR reads, so that is accurate. It's 8 a.m. This is good to go. Next one, furosemide, 40 milligram tab, 40 milligram tabs, Joseph Cool, I see everything is here. Daily PO, what is it for? We know it's for his CHF. So I am going to flip my card over. I know that I've got my med. I see it in the cup. We used the stock Tylenol. It was liquid form. It was 325 milligrams per 5 mils. We knew that we had to double that dosage to make it 650 milligrams, which was in the card or on the MAR. So we changed that to 10 mils. I have 10 mils in that card, so I know that's accurate. This has not expired. We have last, heparin, 5,000 units. I had to use the 10,000 units per mil, but we only gave half of a mil. I see 0.5, or in this case, half mil in this syringe, ready to go, subcutaneous, going into the belly. What am I going to be looking for? I'm going to be asking our patient or our resident if they've had any signs or symptoms of any bleeding. I'm going to be looking around that site. I'm going to be checking maybe the previous site to make sure that we're rotating in the right area. You will oftentimes see where the last site that was used so that you know where to rotate next. Okay, so that's what we'll do. We'll go over to the bed next because now you're going to have to knock on the door, make sure that we ask all the questions to know, do we have the right person? And then we can administer these medications.